this post, we're going to talk about whether or not you should get an MRI for your painful shoulder. This post is going to be helpful to you if you've got a painful shoulder or if your low back bothers you or your X bothers you, because when we talk about the research around imaging and shoulders, it is very, very similar for other parts of the body. So I'm Dr. Alex Ritza, and I am a neurostructural chiropractor practicing in downtown Toronto. And part of the corrective chiropractic care that we provide in our office is all about trying to fix the underlying problem. And that is so applicable to today's video and to today's post. But when it comes to the underlying problem that might cause somebody's shoulder pain or their back pain, often an MRI is not going to show that. So you've got a painful shoulder, you've got a painful back, what do you do? So I'm going to talk about a couple of studies today. So one study is by Aliati et al., and it's from 2001, and it's published in a journal called Pain Republic. And what this study showed is that when the researchers looked at the evidence, they were not able to correlate whether somebody had very low or very high shoulder pain, or how they were able to move their shoulder or not able to move their shoulder, and whether or not they had a rotator cuff tear. I.e., if somebody comes into my office, what this study is showing is that if their shoulder is excruciating versus somebody who doesn't have excruciating shoulder pain, it's not a good predictor of whether that person or those people do or don't have a rotator cuff tear. Same thing if somebody's not able to move their shoulder versus fully able to move their shoulder, not a good indication of whether somebody has a rotator cuff tear. On the other hand, if you have somebody with frozen shoulder and they're only able to abduct their shoulder, say 20 or 30 degrees, like a patient I had today, that person definitely has frozen shoulder. That's a very good predictor in that case. With that limited mobility, that person has frozen shoulder. But it's not a good predictor of whether or not they have a problem with their rotator cuff. And so in terms of whether you need an MRI, there's another really important study that we need to discuss, and that is titled Epidemiology and Demographics of the Rotator Cuff Tear, and that is published in the Journal of Rotator Cuff Tear, and it is from 2016 by Gumina et al. And what this shows is the relative percentage of having a rotator cuff tear in your shoulder at different ages. And so these are asymptomatic people who they've looked at a shoulder, they've either done a dissection if they've passed away or done an MRI, and shoulder doesn't hurt, asymptomatic, and looked whether there was a rotator cuff tear. So I'll put up the slide, but 5% between 30 and 40 years old, rotator cuff tear, no symptoms. 40 to 49%, 40 to 49 years old, 11% of those people had a rotator cuff tear, no symptoms. 50 to 60 years old, 37% of people, rotator cuff tear, no symptoms. 60 to 70 years old, 50%, rotator cuff tear, no symptoms. 70 to 80, 70%. 80 to 100 years old, 80%. So what this shows is that as somebody gets older, they are more likely to have a rotator cuff tear that is not causing them any pain or not causing them any problems. Now, it could definitely be argued that it's going to cause them problems if they push themselves, like try to play tennis, try to play golf, try to throw a baseball. But at least in this study, the authors did not assess for that level of function. They were basically asking or reviewing research where participants said it's affecting my life versus it's not. So these two pieces of research tell us that if somebody comes into my office, I am not really able to tell from an assessment or from hearing them whether or not they have a rotator cuff tear or not, and I can basically guess with how they get older whether there is a tear or there's not. And so whether somebody should get an MRI or not, I can give some further information by talking about a patient we'll call Gord. So Gord came to see me a few months ago, almost a full thickness tear of his supraspinatus, so one of the 4 rotator cuff muscles. He was getting really jarring, sudden shooting pain in his shoulder with random movements that was making daily life very difficult because, he would just go to get up off the couch and terrible pain in the shoulder, or basically any shoulder movement with exercising, with gym, with household activities had been really bothersome and had been bothersome for months. He'd been to physiotherapy, he'd been to see his doctor, he'd done lots of YouTube videos. Nothing has worked. I was, quote unquote, his last stop before he was going to get surgery. So one thing that we did different with Gord was we assessed his body from head to toe, did a really thorough assessment of his spine, of his nervous system, especially the nervous system connection between his neck and his shoulder, and found that basically the left and right side of the spine were completely different. Left side of spine, good shoulder, spine pretty healthy. Right side of the spine, bad shoulder, spine, and especially his middle back up, terrible. Joints didn't move, neck muscles, shoulder muscles extremely tight, nerves leaving his neck very irritated, causing shooting pain down the arm when challenged, or numbness and tingling. He had a significant problem with his shoulder, but also with his spine and with his nervous system. So in Gord's case, what we did was we addressed that. We fixed the underlying problems in his body by getting his spine to move properly, making sure that his nervous system and the nerves leaving the neck were sending and receiving the right signals. The consequence of that was less pain, softer muscles, and a shoulder that a few months later, I think specifically 3, was able to move in a full range of motion, able to do every activity, and within 4 months, no, maybe still 3, Gord has, last time I saw him, had no sudden sharp shooting pain in his life for the last week with moving his shoulder around or when not paying attention to it. So in this case, Gord had a full thickness tear of his supraspinatus. Did it matter? No, not really. Did it make it harder to improve? Yeah, he got better a little bit slower than a lot of other people. But Gord, like so many people, what's happening on their MRI or what's happening inside with not knowing their MRI, it often doesn't matter, and an MRI is usually not that helpful in my practice for how we're going to help somebody and whether or not they get better. Because ultimately, we are going to, and your physician and the medical system and the research indicates that you should always start with conservative care. So you're going to see somebody who's an expert at taking care of the body, and they're going to try their best to get you better. And if it doesn't work, then you should probably go see somebody else. And if it doesn't work, you should probably go see somebody else. And if you're going to see that second person, maybe you should get an MRI, figure out, hey, maybe why is it not getting better? But ultimately, to go in and do surgery or to get an injection, that is going to be why you want that MRI. So you're going to want that MRI if conservative care is not working, and the MRI will probably show or hopefully show you why conservative care is not working. And then the MRI is also going to be useful for your surgeon or for your sports medicine doctor to show them where they should do an injection or where they should do some cutting or where they should do some surgery. So just to reiterate that point, if you're going through conservative care, if you're seeing somebody who's great, who's addressing everything, you don't get better, that's probably when you want an MRI. If you're seeing somebody that's just putting some heat on, some ice, doing some rubbing, you probably want to go see somebody else. The MRI, frankly, for me is not that useful because if I see a tear in one tendon or another tendon or another, I don't know if it's affecting their function. I don't know if it's causing them pain. What I am going to do is do a really thorough assessment to figure out what tendons, what muscles are irritated, what are weak, what nerves are irritated, basically where is the dysfunction, and then try to address the different dysfunctional parts in the body. And in most cases, 95 to 99% of cases, that's going to help somebody get better, help them reach their goals, and help get the body working much better than when they first came in, if not totally back to normal. And the same would go for somebody's low back. If somebody has a disc bulge on MRI, there is a 33% chance that people walking around out on the street have a disc bulge, have no symptoms with their low back. Often what we see on an MRI does not correlate to a symptom or a dysfunction. It may show us that the body's not perfect internally, but your body's an amazing, amazing evolutionary machine, and it is able to create compensatory patterns and to work really well with lots of backups if something is damaged or not working well. So should you get an MRI in the province of Ontario? That's up for your doctor to decide. I can't refer you one anyways. But for the most part, it's probably not needed if you are getting really good care and if you are addressing the underlying problem. I hope that is helpful to everybody. I hope that if you have shoulder pain, you're having some trouble, you can check out our shoulder rehab guide, which is like a 30-minute video on how I rehab somebody from shoulder doesn't work at all to superstar athlete. I'll make sure that's linked. And otherwise, thank you guys for watching. Have a great day. I'll see you soon.